Okay, let's unpack this. We're taking a deep dive into two of the world's oldest and most sophisticated medical systems, traditional Chinese medicine, or TCM, and Ayurveda. And our mission today is pretty straightforward. We want to see how they independently mapped the body's crucial pressure points, especially the ones tied to cardiovascular health.
And what's genuinely astonishing here, the real core surprise, is that these two distinct civilizations, they empirically converged on the exact same highly reactive neurovascular junctions.
Without talking to each other.
Not at all. They basically mapped the same physiological highways from completely different starting points.
And while the points overlap, the underlying map,
Yep.
the framework is different, right?
Okay.
TCM uses qi, this vital energy flowing through meridians.
Right, but then Ayurveda frames it as prana, moving through nadis and also shrotas, and that last one is a really key distinction.
No, so how is that different?
Well, while meridians are primarily understood as, energetic paths of flow, Ayurveda's shrotas are often described as actual physical channels.
Oh, interesting. So like actual vessels.
Exactly. Vessels for things like blood, lymph, digestive fluids. It suggests Ayurveda embedded a physical structural component right into its mapping that's a bit less explicit in the TCM system.
That's a powerful distinction. Okay, so let's look at the functional overlaps, specifically those emergency break points for the heart and mind on the wrist.
Yeah, the distal points. So in TCM, we're looking at PC6, Neguan, and HT7, Shenmin, the spirit gate.
Right.
And HT7 is famous for calming the mind, or what TCM calls the Shen. Functionally, these are known vagus nerve modulators.
Which is why they're so powerful for emotion and cardiac regulation.
Precisely. And Ayurveda has a direct functional mirror for this.
The Kalaradaya Marma.
Exactly, in the center of the palm. Talaradaya is crucial for regulating the autonomic nervous system and managing what they call Vyana Vata, the aspect of prana that governs all circulation.
So both systems figured out that pressure way out on the wrist has this profound reflex action right back on the heart.
It's amazing.
So if that's the local control, let's move to the central engine room.
Yeah.
The center of the chest. In TCM, that's CV17 Shanzong.
The master point of gathering qi. It's the absolute center of vital energy in the torso. And Ayurveda locates a major center right there too, Hridaya Marma.
One of the three great Trimarmas.
One of the big ones, yeah. And for both systems, this point is just non-negotiable for respiration, circulation, and deep emotional balance.
Okay, now let's shift from the chest to systemic vitality. The points they use to just keep the body's battery charged. TCM has ST36, Zuzanli, that famous leg point.
The great tonic point. And it aligns beautifully, functionally, with Urvi Marma, located mid-thigh. But this is where that Srota framework really matters. Urvi is anatomically linked to the femoral artery and vein, and it's said to control the body's blood tissue, the Rakta Dhatu.
So while ST36 is boosting the flow of T,
Urvi is regulating the actual quality and structure of the physical vessel and what's inside it.
this is fascinating. This is where their agreed-upon anatomy meets this huge technical divergence. I mean, TCM uses precise, rapid needling.
Right. To disperse or tunify?
But Ayurveda treats those same points with such caution. Why? What's the difference in technique about?
The historical context is everything. Marma mapping originated in battlefield medicine. Injuring a major marma was known to be fatal. They called it Sadhu Pranahara.
Wait, so you're saying they had to invent a gentle technique like massage because they were afraid that if they pressed too hard, they might actually kill the patient?
It fundamentally shifted their entire approach from invasive to non-invasive, yes. And then Ayurveda adds this other layer of customization.
A constitutional focus. The doshas and prakriti.
Exactly, the person's unique nature. This means the treatment is personalized right down to the chemistry.
How so?
While Marma therapy uses dosha-specific oils, if you have a dry, cold vata constitution, you're using warming sesame oil, fiery pitta type, you're getting cooling coconut oil.
So you're addressing the physical point, the energy, and the person's fundamental constitutional needs all at once.
All at the same time.
So what does this all mean for you, the listener? The synthesis is powerful. TCM seems to focus on restoring flow-moving qi and blood stasis.
While Ayurveda is focused on the quality and constitution of the underlying tissues themselves.
Which brings up a really provocative thought to leave you with.
It does. I mean, what if you combined them? What if you took the precise diagnostic pattern matching of TCM, say, identifying a specific meridian blockage, and you paired it with the gentle, customized touch of Ayurvedic Mardana using a dosha-appropriate oil?
You could get a synergistic effect.
You could potentially achieve a systemic effect that targets both the immediate energetic problem and the person's deep constitutional well-being. It's a fascinating path for future exploration. Welcome back to the Deep Dive. Today, we're not just exploring a topic, we're really breaking down what looks like a strategic battle plan. We are diving deep into the core of traditional Chinese medicine cardiology, specifically how these master acupoints are deployed as targeted command centers to manage some really serious chronic conditions. We're talking hypertension, angina, chronic heart failure.
That's a perfect way to frame it, a battle plan. Because what practitioners are doing is executing a multi-system intervention. They aren't just looking for a single point that might lower blood pressure for a bit. The whole mission is to address the underlying the systemic syndrome or imbalance. So the strategy goes way beyond just symptom relief. It's all about root regulation.
Okay, so let's unpack that strategic thinking. The source material we have lays out these interventions in 3 core categories, and it almost seems like a sequential approach to getting the system healthy again. First, you calm the chaos, then you build up the engine, and then finally you make sure all the pathways are clear. So we're talking about 1, the neurovascular command centers, 2, the metabolic foundation, and 3, the indispensable category of flow promotion.
It's just a very pragmatic structure. I mean, if the body is in total sympathetic overdrive, you can't effectively kunify it, right? Or if the energy supply is weak, trying to move blood is only going to exhaust the system even more. You have to address these things in order.
Exactly. So let's jump right into category 1, the neurovascular command centers. So if a patient comes in and their heart feels erratic or they have this chronic anxiety that's physically destabilizing their whole cardiovascular system, these points are described as the fastest route, the fastest way to stabilize rhythm, balance that autonomic tone, and calm the Shen, the mind or spirit.
And the primary point here, the immediate responder, is pericardium 6, PC6. It's known as naguin, or innergate. We pretty much label this point the vagal regulator.
The vagal regulator.
It's just indispensable because of its confirmed physiological role in modulating the vagus nerve. And that nerve is the primary brake on the whole sympathetic nervous system.
And that vagus nerve modulation, that's so key because that constant low-grade sympathetic overdrive is, it's the hallmark of so many modern NCDs. It contributes massively to sustained hypertension and that chronic stress that just wears down the cardiac muscle over time.
Precisely. So needling PC6 gives you a non-pharmacological means to manually dial down the volume of that fight or flight response. And the research is really compelling. Stimulation of PC6 is clinically confirmed to reduce both elevated blood pressure and heart rate in acute settings. That makes it essential for managing, say, sudden palpitations or that feeling of chest tightness.
So is its action purely electrical, or is it engaging with the chemistry of the body as well?
It's both. And that's what makes it a command center, you see. Its main pathway is neurological, that vagus axis modulation. But its regulatory effect is so profound, it's not just focused on the heart. We use PC6 globally to harmonize the entire thoracic and upper abdominal cavity, which is why it's so famous for treating things like nausea and vomiting. That connection just highlights its systemic reach. It stabilizes that whole core channel running through the chest.
Okay, so if PC6 is handling the fast, acute autonomic stuff, the next point you see is Heart 7, HT7, Shen Spirit Gate. This one seems to address the chronicity of it all. I think of this one as the Shen master, what makes it the single most important location when the heart is destabilized by, the mind or emotions.
Well, HT7 is the source point of the heart meridian, and its whole job is to nourish the heart and calm the Shen. When we talk about these cardiac NCDs, you so often find this contributing factor of chronic insomnia or persistent anxiety or just this pervasive restless thought that exhausts the heart's resources over time. And that leads to deficiency, instability. So HT7 is foundational for treating that internal mental turbulence.
And this is where the modern physiological research really bridges the gap, isn't it? The source material points to studies confirming that stimulating HT7 can actually increase calming neurotransmitter levels, specifically GABA in the hypothalamus.
That is the ultimate confirmation for us as practitioners. It tells us that when we say we are calming the spirit, we are literally changing the neurochemistry of the patient.
Yeah.
You're helping them transition out of that chronic stress state and into a parasympathetic sort of recovery state.
Yeah.
And for a cardiac patient, HT7 also positively modulates electrophysiological parameters, meaning it directly helps regulate the heart's electrical stability. And that is absolutely vital for maintaining healthy heart rate variability, or HRV. Low HRV is a major predictor of poor cardiac outcomes. So regulating it means regulating recovery.
So if we look at this as a dynamic duo, PC6 manages the immediate physical reaction, the sympathetic overdrive, and then HT7 manages the chronic neurological substrate, the Shen disturbance, the GABA deficiency. Together, they are that crucial first step.
Absolutely. And we have to quickly mention conception vessel 17, CV17, Shanzong. While PC6 and HT7 are about regulation and calmness, CV17 is the master point of qi. It regulates and distributes key our body's functional energy all through the chest.
Why is that smooth key distribution in the chest so critical for a failing heart?
Well, if the qi is stagnant, you get that physical feeling of oppression, shortness of breath, that subjective chest tightness. In Western terms, you could say this qi stagnation can hinder the heart's ability to move blood effectively. It can really impact the diastolic function, the heart's ability to fill properly. So CV17 just ensures that smooth, expansive, free movement that you need for both the lungs and the heart to work together.
That brings us to a really strategic pivot. We've secured the control room, we've calmed the chaos, so now we shift gears into category 2, the metabolic foundation and energetic support, because a calm heart still needs high-quality fuel, right? So this is all about supporting the body's energetic engine, the spleen and stomach, to create those raw materials, qi and blood.
And this is where we meet stomach 36, ST36, Zuzanli, or leg 3 miles. If I had to choose just one single point for systemic resilience, this would be it. It is truly the point of ultimate tonification.
We often hear about ST36 for digestion, sure, but let's connect it specifically to the long-term management of cardiac NCDs. I'm thinking chronic heart failure, where that fatigue is just debilitating.
It acts as the ultimate supply chain manager for the heart. By fortifying the spleen, ST36 basically maximizes the efficiency of turning the food you eat into vital energy, or qi, and blood. In the context of chronic disease, this prevents the devastating effects of what we call deficiency syndromes. You know, that lingering fatigue, chronic weakness, the palpitations that pop up when the heart just doesn't have the energy or the nourishment to function effectively. It makes sure the system has the necessary material, not just the ability to move it.
And is there any modern research on ST36 that supports this foundational role?
Oh, absolutely. There are studies suggesting that ST36 stimulation can enhance mitochondrial function at a cellular level. So it's essentially making the body's energy production cleaner and more efficient. For a patient with CHF, improving systemic energy and reducing that chronic fatigue, it's just indispensable for their quality of life. For preventing further decline is really about supporting every cell in the body to work better.
And then complementing that sort of brute force tonification is spleen 6, SP6, the Sanyin Jiao 3-yin intersection. This point seems less about pure volume and more about, elegant regulation.
That's the perfect way to distinguish them. SP6 is where the spleen, liver, and kidney yin meridians all meet. That makes it a powerful systemic regulator of blood and yin deficiencies. But in cardiology, its role in fluid metabolism is arguably its most crucial function.
You're talking about the TCM concept of resolving dampness that can lead to phlegm turbidity. How do we translate that for someone listening in a cardiovascular context?
Okay, so think of dampness as chronic systemic congestion, sluggishness, often related to poor digestion fluid retention. When this dampness condenses, it becomes what we call phlegm turbidity. In modern terms, this mirrors very closely the formation of circulating lipids, chronic systemic inflammation, and the precursors of atherosclerotic plaque, all of which are dangerous factors in coronary artery disease. So we use SP6 to metabolically clean the internal environment. It ensures that the system isn't just running on high-quality fuel, thanks to ST36, but that the fuel tank itself is clean and free of sludge.
Right, so we've calmed the nervous system, we've secured the engine's fuel supply, but none of that matters if the pipes are permanently blocked. And that leads us directly into our third and final category, flow promotion and stasis resolution. This is mandatory when you're dealing with ischemic symptoms, that fixed stabbing pain or angina pectoris, which TCM attributes directly to obstruction, to blood stasis.
That's right. That feeling of fixed, sharp pain signals an emergency flow is stopped. We have to restore movement immediately. And our command center here is liver 3, LR3, or Taishan. Its core function is just to ensure the free, unrestricted flow of qi throughout the entire body.
Okay, so if qi flow is the foundation, how does LR3 specifically help manage something like chronic hypertension, which needs long-term regulation?
LR3 is the essential pressure release valve. It does this primarily by subduing what we call liver-yang hyperactivity. And this hyperactivity is a key pathological factor in so many cases of essential hypertension.
So it's like stress-induced pressure.
Exactly. Think of liver-yang rising as stress-induced pressure. It's like constantly pushing the gas pedal. This uncontrolled pressure rushes upward, it disturbs the heart and head, and it leads to those sustained high blood pressure readings. By stimulating LR3, we gently release that pressure and ensure smooth circulation. And the clinical evidence for its efficacy in lowering BP is very strong.
So LR3 is the anti-stress, anti-stagnation point. Now, to really move blood that's already stuck, the sources point to specific activators. What are the key points dedicated explicitly to moving that blood stasis out of the system?
We really rely on two major points for this: spleen 10, SP10, the Suhai or sea of blood, and bladder 17, BL17 or Geshu. SP10 is on the thigh, and it's used explicitly in protocols to activate blood circulation and dispel acute blood stasis. It really targets the systemic movement of blood in ischemic scenarios.
And BL17 sounds like it governs the whole strategy, being the influential point of blood.
It is. It's the ultimate governing point for all blood issues. If SP10 activates, you can say BL17 regulates the overall function of blood across all the channels. It just decisively reinforces the strategy to manage chronic stagnation. It makes sure the whole system, from the liver's role in storage to the spleen's role in formation, can move the blood efficiently and prevent that stasis from coming back.
This really does paint a comprehensive picture. It's not a fragmented treatment plan at all. You start by regulating the neurology, calming the patient with PC6 and HD7. Once you have that stabilization, you build the foundation with ST36 and SP6 to give the heart the energy it needs and clean the metabolic environment. And then finally, you ensure clear pathways by subduing that liver pressure with LR3 and activating circulation with SP10 and BL17.
Exactly. The success of TCM cardiology really lies in this multi-system intervention. You're treating the entire ecology of the patient. You're moving beyond just the high BP number or the chest pain and addressing the fundamental imbalances: the neuroendocrine chaos, the metabolic failure, and the systemic obstruction.
It's a remarkable fusion of strategic thinking and very targeted physical engagement.
And here's the final thought I'd like to leave you with. Given that modern research is now confirming that points like HT7 can directly increase calming neurotransmitters, specifically GABA, in the hypothalamus, this raises a really crucial question about the future of medicine. How much of traditional cardiac management could be profoundly enhanced simply by prioritizing and optimizing the non-pharmacological regulation of the body's own internal neurochemical landscape?
A profound thought indeed. Thank you for guiding us through the strategic deployment of the TCM Cardiology Command Centers. We encourage you to explore that connection further between these specific acupoints and their verifiable neurological outcomes. We'll see you next time for another deep dive.